so excited to have the three of us together because we always have so much fun talking about science and health and all the different lenses that we can use to look at a condition like MS. And I'm so fortunate to have both of you on the Truemedicine team. Anne-Marie, you as one of our co-founders, and Coach Dr. Roberta as our health coach that meets with participants every week in our Zoom meetings. You both have a background in traditional Chinese medicine and understand the beauty and the intricacy of it. And I think it's so important that we share this information with people who are living with MS, because this is a powerful tool that we're just not using. And it's so common sense in so many ways that it's a shame if we don't take advantage of it. So Coach Dr. Roberta, you want to give us a little background on how traditional Chinese medicine developed?
Oh, absolutely. I love that subject. And like you said, it's really a missing piece, right? That we are, by bringing this concept of ancient medicine and traditional Chinese medicine to our conventional medicine that we have now, we are really broadening our thoughts, right? The way we look at patients now. Because if we think that before we had labs and imaging and all these amazing technology that we have now available to us, the Chinese, they were able to diagnose disease. They were able to treat disease using what they had, which was like nature. They would observe nature, observe the changes in the seasons and how their emotions would affect their health. And it was really how Chinese medicine came about. It was through observation. And yeah, would you add anything to that, Anne-Marie?
Yes, I would. It's the interplay of the environment, the food we eat, the temperament, our lifestyle. Like, they were really geniuses of looking at all the different aspects of life and who we are and how we fit inside this world and how each of those aspects affected one another.
So I think it's so important that both of you brought up the word environment. How often when we look at information about MS, do we see MS is 20% genetics and 80% environment, right? And those are not exact numbers, but environment is huge. And where in Western medicine are we addressing environment?
Mm-hmm.
And what is the environment, right? Environment is the forces that we're subjected to, whether it's environmental forces like the seasons, light, temperature, but it's also foods, activity, behaviors that we engage in, how we're sleeping. And this is the big missing piece of our MS care, that we're just not trying to at all address the big 80% chunk of what drives MS. And Chinese medicine does a beautiful job of weaving that in. So are there any examples you could give us that kind of gives it some validity to Chinese medicine? You know, these ancient doctors and masters identified acupuncture points. Like, how do we know that that was actually a thing?
That is a very good question. And actually, that's a question that brings a lot of discussion, right? Because like the way Chinese medicine see health is through the lens of energy. Everything is energy, and we are energy. Our environment is all energy, and our health depends on that mutual relationship happening in balance. And we're all constantly looking for balance. So there are some now techniques that you can use, like some instruments like point locators, where you can really identify, you know, where the energy is flowing in your body. I think specifically you can identify meridians and acupoints, and it can help you diagnose and treat conditions according to Chinese diagnostic methods. And anything else, Anne-Marie?
You know, there's There's one point that, you mentioned the point locator, and,
Mhm.
certainly we can find those on the body, but there was also some studies that have been done talking about one specific point in general, and it's
Mhm.
called stomach 36, Zhusan Li. And I like to call this a 5-star point. So acupuncture has like over 400 points on the body, and some are used more than others. And I found in my training that there's kind of like 5 points, 5 to 10 points that are 5-star points. They can be used for so many reasons. So many different conditions, so many different diagnoses, so many different treatments. They're like the superstar points that can affect multiple aspects of the body. Stomach 36 is one of those. And there's a couple studies done that really show the that it's real, right? That it's not just this, something that Chinese medicine said that works, but there was a rat study done that shows that electrical stimulation at this point modulates gastric motility via the vasovagal and sympathetic reflexes. I mean, that's pretty cool. In the Chinese medicine books, it actually says this point is to harmonize the stomach. And then later, these studies show that it actually is modulating gastric motility in the stomach. I think that's pretty cool.
So
And it also has anti-inflammatory benefits. So clinical benefits of relieving inflammation through several mechanisms: the vagus nerve activation, macrophage polarization, and cholinergic anti-inflammatory pathways. I mean, that's pretty cool, in my opinion, that something that they found and used thousands of years ago now has validity, and specific validity too.
yeah. And also, if you go through process, right, of treating through acupuncture, you can. I always feel like the clinic is the what you should look for, right? Like it's because sometimes you look at lab results, and then you feel like so good. Oh my God, my labs. You feel good about those labs, but you don't really feel good in your body.
Mhm.
And in terms of Chinese medicine, sometimes you see the change right away, like most of the time, right? And talking about the vasal nerve stimulation, right? Like so I think like how you feel, that's the best way to acknowledge benefits, right? Like, and I'm not saying we shouldn't consider all those beautiful articles, but like go experiment it with it yourself and
Well,
find out.
you bring up a really good point as far as like the labs can say one thing. In Chinese medicine, and you also say that the clinic is like kind of really where it's at. One of the things in Chinese medicine is they've really, in training, is that they really elevate the subjective skills of the practitioner, observational skills, I should say. So the looking, the touching, right? Like modern medicine nowadays doesn't do as much touching of the person. And there's not as much training on how to look at someone and see kind of through their eyes or in their skin, or, how they're laying on the table and what that means, and to bring that into the diagnostic process. Right.
Yeah.
So when I treated patients, I would go in and I would literally, from the moment they walked down the hallway and into the room, was observing, how are they walking? How is their spirit showing in their body? Are they sitting? Are they walking upright? Are they bent over? Do they have a hard time talking, right? Because they have labored breathing. Or are they so excited they're just talking and talking in a really loud voice, or really quiet, like, and then looking at their eyes and how sparkly is their eyes. Right. And when I touch their stomach, is their stomach warm? Is it cold? Do they wince when I touch them? Right? Do they relax when I touch them? Like, all of this is brought into the process of how we assess how someone's wellness and their health is. The labs are great and they can add to that, but it's, for us, it's just one piece of it.
Yes. Yes. To that point, like let's talk about maybe the therapeutic encounter, right, Dr. Susan?
Sure.
Right?
Yeah.
with that, it's just so natural in Chinese medicine and like conventional. Can you look at me like I'm already interviewing you? I'm sorry.
It is
Yeah,
really important because, when we interact with other people, whether it's person to person, practitioner to patient, there's an energy exchange. And just by having established a therapeutic encounter between the person that is treating you and trying to make you well and heal you, there is actually power in that, right? There's studies that show like people who, had a cold, they went and saw a sympathetic doctor, a neutral doctor, and like an uncaring doctor who didn't really establish rapport with them. And the people who, and I think a group stayed home. The people who stayed home got over their colds faster than the people who went and saw the unsympathetic doctor. Right. So this speaks to the power of the people that we choose to heal us and how we as healers and practitioners should show up with our energy, where we're really focused on that one patient and we're not thinking about other things, and really having an intention about doing our very best for the patient and connecting.
Agreed. And, I have heard it numerous times where patients will say, I felt really seen, right? I felt it when they go see their acupuncturist. I felt really seen. I felt really heard. And for people with MS, those who are more homebound, not as abled in movement, they don't get touched very often. So that's another beauty of Chinese medicine is the practitioner has to touch your body. And usually it was with sympathetic hands, right? And that somebody will say like, oh, I haven't been touched, right? And that alone sends healing signals into that person's nervous system.
Can I tell you something? I love getting MRIs. I love them because it is a time where I'm the patient and somebody's taking care of me. They give me the warm socks and the funny gown. And then they go, do you want a warm blanket? And are you okay? It's so special actually to be taken care of and to feel like people are thinking about you and your comfort and your well-being. So look, there are limitations with Western conventional medicine. There are limitations with Chinese medicine. They are different lenses. Nothing is complete, but what we are arguing for is to bring those things together so that you can get the best of both worlds. So me as a conventionally trained physician, I'm well aware of the limitations of medicine. I used to practice anesthesia at a trauma center. We did incredible things. I was so good at it that a gunshot wound to the heart would not even excite me. I would just, know what to do because I had done it so many times. And, we can patch people up and send them home a week later. I mean, it's incredible what we can do with technology and conventional medicine, surgery, and some of our pharmaceuticals. But there is a problem with Western medicine where we are not very good at dealing with chronic conditions. We give medications to cover up symptoms, make people feel better, make their numbers and labs look better, but we're not really treating the problem at its root cause. And it's very reductionistic. So I always think of the example of when I was an anesthesiologist peeking over the curtain onto the surgical side, and we have this amazing, wonderful human being laying on the operating room table, tons of drapes, and the only thing the surgeon gets to see is this little square that's peeking out where they're going to take out the appendix. So this amazing human being in the operating room has been reduced to this, 4 square inch area that the surgeon is staring at. And it is hard to remember that there's a person under there, especially when you're doing this every day, all the time. And, behind the scenes, when we're really busy at the hospital and we're just kind of trying to get cases going, sometimes we refer to people as bring in the appy, bring in the chole, bring in the bowel obstruction, right? What happened to the bowel obstruction? Rather than the person so-and-so who had the bowel obstruction. It's a function of our doctors and nurses and healthcare staff being overworked and just, pushed to the limit. But it is what can happen when you are trying to get through a large volume of work and you're trying to reduce a large volume of information down to something very simple that you can just treat and move on to the next thing. And what I love about Chinese medicine is that you're really trying to be expansive and look at the organism in its entirety and how it interacts with its environment. So
Yeah, and as you share this, it makes me think about my own experience as a dentist, right? Because like I use as a dentist, like you're limited, and that's how I used to say when people ask me like, how do you feel about not being like actively practicing dentistry? And I'm like, well, I am practicing. The thing now is that the things that I was limited to these good, right? I was limited to the mouth. So it was all like treatment based, right? That's how conventional dentistry is today, right? You have cavities, you go to the dentist, you put fillings, go home, right? That's conventional dentistry. And now there's this new realm of dentistry called the biological, right? Biological dentistry, where you're really looking at the whole person, not just the mouth. And yeah, so it really, I feel like medicine, we are evolving, right? With functional medicine now, it's kind of, I see it like in the middle of like all the knowledge we have from Chinese medicine and conventional medicine, and with dentistry the same, right? We're not just looking at one piece of the person or just one area, but we're starting to look at the whole person.
and
So
as we develop greater tools in the areas of, for example, Western conventional medicine, we are now able to have these conversations about different aspects of a person. So if a doctor has learned about how to counsel someone with nutrition, they can now start asking questions where their counseling in nutrition can help that person. Do you know what I'm saying? So you can only use the tools that you have. And I think one of the reasons in Western medicine, we use a lot of pharmaceuticals and surgery and procedures and labs and radiology is because, for something like fatigue, it's not something we can measure with our conventional medicine tools, and we don't have great treatments. So, Western medicine doesn't do a good job of treating fatigue. But if we were to say, look, for fatigue, let's counsel you on deeper restorative sleep. Let's talk about nutrients that can be building blocks for producing energy. Now you have something to talk about and have a conversation about. But we're not quite there yet in Western medicine, where we're bringing in the environment of that person. But it's getting there.
Well, you bring up an excellent point, and something that I always talk to my patients about is, they would say, oh, my doctor didn't do this, or my doctor didn't do that, or whatever. And I would step back and say, like, well, let's look at their training, and let's look at the training for Chinese medicine and for naturopathic medicine and for functional medicine, right? Like when we go to school, we go to, learn X, Y, and Z, and then you treat it by ABC, right? So each type of medicine has their own way of approaching it. If you can't expect your medical doctor to give you advice on something they weren't trained in, right? The tools in their toolbox, like you said, are amazing for certain conditions. But if they don't have enough tools to address the things that you don't get as good a response from, right? Then either you can look to another style of medicine, right? Or practitioners within each of those types can take on and learn new tools to provide more holistic care.
absolutely, yeah.
And this is why having integrative medicine is important, and functional medicine, because there are people who have that training. And so I always say, we shouldn't expect our neurologists to also be integrative medicine doctors.
Exactly.
It's actually not part of their training. And I want my neurologist to be really good at neurology. But I also want them to tell me, hey, sleep, exercise, stress management, and nutrition are also important. Let's hook you up with resources to go learn about those things. So we shouldn't have unrealistic expectations of our neurologists either. But we can get the best of both worlds by us as patients seeking out integrative medicine, Chinese medicine, functional medicine, in addition to neurology care.
Yeah.
So in Western
Talking-
medicine,
can I just say something? Talking about being your own health advocate, right? Like, how important is that? And that's how the program that we offer here at Truemedicine, it's so powerful, because like, no, like you said, like, yes, we need a best neurologists. We all want the best doctors in our lives, but there are things that only you can do for yourself, and you need to educate yourself about your condition and what you can do on a daily basis to feel better, and to interact with the world in a better with a better mindset. And that's what we teach here, and that's why we're having this conversation here about traditional Chinese medicine, right? Because it's one more way to see your condition and to manage your symptoms and to interact with the world around you. I just wanted to say that.
Well, I'm glad you said that, because I was thinking the very same thing. Is we're talking about all these different styles of medicine or approaches. Like, it's good to have a healthcare team, right? So you have, your neurologist that can help you in one way, and you have, a functional medicine practitioner, a nutritionist, et cetera, that can help you. But you yourself also have to be on that healthcare team, right? So, like you said, Roberta, the program teaches you about sleep, exercise or movement, food, stress management, how to handle toxins. So the more you arm yourself with information, and then Chinese medicine advocates for learning about yourself and your environment, then you become an informed participant in your own healthcare, of being on your own healthcare team.
It's so important. And it's a model that works really well if you think of the patient as the center of the team, and you look at all of the consultants and practitioners around that person. And their job is to give advice and recommendations. And ultimately, the patient, along with the support of their family and friends, will decide what things make sense for them and engage in those things. Sometimes I feel like people just need permission to start taking ownership of their own health, and we all have permission, and this is what we should all be doing, making sure, however, that we're choosing practitioners that are well trained and that they're on the lookout for interactions. So the beauty is that we can have the best of both worlds. We've got neurology care with DMTs that have just come on the market in the last 2 decades that have narrow targets, and they have really powerful impacts on a narrow target in the immune system. And if we can add to that a therapy with very broad effects, something like a form of holistic medicine like Chinese medicine, we start bringing the body back into balance at that cellular level. And so perhaps your DMTs can be more efficacious. Perhaps you may experience less side effects and even less progression of MS symptoms and less flares. So my hope is that we start integrating our care by bringing in different tools. It's so important. And I hope that we can just keep this conversation going, and we'll keep bringing new topics to the MS community.